I'm Joe Hamilton, and today I'm going to be talking to you about mental health disorders. When we're talking about your mental health, there really are three main components that seem to most determine if you're going to have some mental health concerns. The first thing would be your genetic components, and that's why it's important to be aware of your family history and if you do have a history of mental health concerns. Also, some environmental components, and we know that stress is a factor in mental health concerns, and so a highly stressful environment can be a factor in developing mental health disorders. And lastly, some individual characteristics, a particular person's personality and their level of resilience can play a role. This chart has a listing of the most common mental health disorders. When we're talking about a mental health disorder, it would be symptoms that disrupt your life and daily functioning. So, are you having symptoms to the level that it makes it difficult to have healthy relationships? Is it interrupting with your ability to finish your schoolwork, to function in school, to do your work, or perform your tasks for your job, things like that. And does it really kind of disrupt your daily functioning? So, as you can see from this chart, the most common mental health disorders are anxiety disorders, followed by depressive disorder, then substance use disorders, bipolar disorder, eating disorders, and schizophrenia. About a quarter of individuals will experience the symptoms of a mental health disorder each year, and about half of people will experience the symptoms of that meet the criteria for a mental health disorder at some point in their life. Alright, this slide has more information about anxiety disorders. When we're talking about an anxiety disorder, typical symptoms include the physical symptoms like increased heart rate, sweating, shortness of breath, chest pain, chills or hot flashes, dizziness, trembling, and muscle tension. And really, they do as you feel anxious a lot of time. A person might experience thoughts of fears of dying or like that they're going crazy. Sometimes people, when they have all of those symptoms at once, think they might be having a heart attack. That can also lead to concentration and focus difficulties, irritability, and sleep difficulties. This talks about specific types of anxiety disorders. The most common is phobias. Now, many people have phobias, for example, like a fear of snakes or a fear of heights, but it doesn't necessarily disrupt their daily functioning. A lot of times you can avoid the thing that you're afraid of, and it's not disruptive. But if you have social anxiety or social phobia, for example, that can be something that can be pretty disruptive because it's pretty hard to function without ever being around people. So those are the type of phobias that can be most disruptive. Another type of anxiety disorder is panic disorder. So when a person experiences a panic attack or anxiety attack, it's when they have a lot of anxious symptoms at once. So it's feelings of anxiousness and panic, and then it can be also like a pounding heart, chest pains, difficulty breathing, and so those can be very frightening experiences, and it's a very intense feeling, and usually they last for a pretty short period of time. Now, many people experience panic attacks, but they don't necessarily develop into a panic disorder. So once again, if the person starts to experience frequent panic attacks or anxiety attacks, and they start to disrupt their daily life, then that can lead to a panic disorder. Generalized anxiety disorder is when a person feels anxious most of the time, even when they're like home alone by themselves. They still feel a lot of anxiousness or anxiety or worry. And so they're experiencing that anxiousness at all times, not just when they're in anxiety-provoking situations. Another common anxiety disorder is obsessive-compulsive disorder and post-traumatic stress disorder. This slide has symptoms of major depressive disorder, and if you have a diagnosis of depression, it would be when you experience these symptoms most of the day, most every day, for a 2-week period or more. The first one is a sad, empty, or anxious mood. Sometimes it can also be anger, irritability. And then next is a lack of interest in activities that you used to enjoy. So you need to have one of these first two, and then 5 out of the 9 total. So the other symptoms are feelings of guilt or worthlessness, lowered energy or feeling tired and fatigued, sleep difficulties, and that can be difficulty going to sleep or sleeping more, or also frequently waking up during the night with difficulty going back to sleep. A lot of times there's concentration difficulties or just focusing and making decisions. You can have an appetite increase or decrease, psychomotor agitation or retardation. So for some people they become more restless, and some people become more lethargic. And then finally, suicidal thoughts, or sometimes it can be just thoughts of death. So sometimes people would be thinking about their own funeral, or maybe who might be attending their funeral. This slide has some information on the connection between stress and depression. So I'm sure you've seen the commercials on TV where they talk about a chemical imbalance. I'm going to try to explain that a little bit more to you to understand what is happening. So we know that that the stress hormones in our bodies trigger our fight or flight response, and sometimes when that system is not functioning, that can inhibit the growth of new nerve cells as well as glial support cells. And these are the cells that affect emotion, memory, and learning. So something called neurogenesis, that means the creation of these new nerve cells, can be modified by positive things such as learning, physical exercise, and hormonal influence, as well as negative things such as acute and chronic stress. So basically, if you're under a lot of stress, then we just aren't creating those new nerve cells and glial support cells that help us create those new connections where we store the memories and the learning and the emotions that go along with that. And so over time, if you're experiencing a lot of stress and that's suppressed, then that can lead to depression. This slide has information about suicide rates among males. As you can see, with the 10 to 24-year-old group is the lowest category. And then next we have what we call the working group, age 25 to 64. And then the highest rate is among males 65 years and older, although that has been declining. Suicide is the third leading cause of death among 10 to 24-year-olds. And we do see an increase in suicide rates among the working class when there are troubles in our economy. Now this slide has information on suicide rates among females, and this does come from the Center of Disease Control. When we talk about death rates, it's always a rate per 100,000 of the population. And so the 10 to 24-year-old group among females is the lowest, followed by the age 65 and over, and then the working group is the highest rate among females. And then I combined these two charts together to give you a picture, so it's a little bit distorted down here, but the suicide rate among all female groups is lower than all male groups. So this chart gives you an indication of that. However, we do also know that women are much more likely to attempt suicide. When we're looking particularly at college student suicide, the college suicide rate is about 7.5 per 100,000, and that's about half the rate among traditional age college students compared to their peers of the same age group who are not attending college. This is some information from the 2013 National College Health Assessment. Truman students reported these things in the last 12 months. About 2/3 at some point said that they felt very sad. About half felt that things were hopeless. 30% felt so depressed at some point that it was difficult to function. About 7% seriously considered suicide, and about 1% attempted suicide. And that rate, about 1%, is about the same rate that you would see in a national sample. So now if you have concerns about a friend who may be at risk for suicide, that we do have some training. It's called QPR, so question, persuade, refer. So this is a very brief explanation of how to intervene. But I would encourage all of you to either take the Ask, Listen, Refer training that's available on our website, or to attend a QPR presentation. So, and we will be doing QPR training throughout the year. This is some information about bipolar disorder. In bipolar disorder, people have the depressive symptoms, but they also have oftentimes manic symptoms. And so it can be things like inflated self-esteem for a period of time, a decreased need for sleep, and in fact really there's more of a focus with the bipolar disorder being more about energy and the shift in energy than mood, but we do see those changes with energy levels. So being more talkative than usual, having racing thoughts, being very distractible, an increase in goal-directed activity, and then excessive involvement in pleasurable activities. So it could be an increased interest in sex, or maybe shopping, eating, those kind of things. Now, not everyone with bipolar disorder will necessarily have a manic episode. Sometimes they rotate between a depressive episode and what we call a hypomanic episode. So you wouldn't necessarily notice a drastic change in behavior. Probably you'd see more of the increased talking and increased energy and lack of sleep, but not necessarily anything that would seem really too much out of the ordinary. This talks about some other psychological disorders. They're common: substance abuse disorders, eating disorders, schizophrenia, and a lot of times we see in college that students have ADHD, that they've probably had most of their life, but because they've been a very good or high-functioning student, it didn't necessarily interfere with their academics, and so it's not till college that it starts to be a problem. This has some information from the National College Health Assessment, and as you can see here at Truman, the #1 thing that students report that interferes with their academics is stress. Here's information on our services. University Counseling Services is located within the McKinney Center, the same entrance that you would go into for the Student Health Center. We provide confidential counseling to Truman students. We have 5 full-time professional therapists. We're all either licensed or working towards licensure. And if you are concerned about someone who's in crisis, you can call 660-665-5621. Thank you.